McInerney here at the Mental Health Victoria launch of the Saving Lives, Saving Money report, and I've jumped on people to do a little bit of a vox pop. So we're going to start. Perhaps if we can start first with you, Liz. Can you introduce yourself and where you're from?
Yeah, my name's Liz Crowther, and I'm CEO of Wellays Australia.
And can you say what Wellays does?
Yeah, we support people who have mental illnesses, their families and their friends, and we work with about 8,000 people a year.
What's your big ask out of an event like this, where we're looking at gaps in the system, particularly in Victoria?
My big ask is that the state government funds psychosocial rehabilitation.
And what's the problem with it here?
The problem is that people can't get the support they need. The current funding of NDIS is not skilled enough, not adequate enough to meet people's needs. People don't need to have assistance with showering. They actually need assistance to identify the issues that they're struggling with and to get plans for a better life.
And that's the big issue here in Victoria, isn't
Absolutely.
it? That the money for those services has been folded now into NDIS.
Absolutely. That funds people at about $40 an hour, whereas before those people were funded at $86 an hour. And they were able to deliver specialist interventions.
Thank you very much, Liz. Now I've got Andrew from KPMG. Could you introduce yourself a little more, what your role is?
Yeah, my name's Andrew Dempster. I'm from the Health, Ageing and Human Services practice at KPMG, and we've been involved with Mental Health Victoria in producing the, if you like, the economic argument behind some of the figures that you see in the report. And I think really probably the key things for me out of the report are highlighting where there's been some real gaps in the Victorian system in terms of what Victoria covers for people with a mental illness compared to some of the other states and territories. And really I think that we've really lagged behind, and prioritising where some of that investment could be best used. And I think while I'll leave the specific figures for Chris Schilling, my colleague, to talk about, I think what's really important, and I suppose I want to emphasise, is that really behind each of the statistics and the numbers in this report and the gaps that we talk about, there's actually an individual, a person with a mental illness who might be struggling in whatever aspects of their life that they've got, and getting access to a service and getting access to support in a timely way is really what's needed. And I think what we're seeing at the moment is a system where there's too few services available, and there's some real challenges around access to crisis services and emergency departments becoming the norm.
You were struck by a conversation you had with a woman who'd experienced homelessness. What was it that she'd found made a difference?
In terms of, I suppose it was interesting, she'd been homeless for a number of years and really struggled with long-term mental illness, and the things that really made a difference were actually personalised sort of care and support. And her caseworker that she actually had support from was, took an interest, actually respectful and engaging in terms of providing practical supports, and some of the things like access to stable housing, access to dental care and other physical support really made a significant difference in her life, and she was able to actually then go to appointments, actually get on top of things in terms of her mental health. So I think they're the sort of the things that stood out for her.
Fantastic, thanks Andrew. And Chris?
Hi, so my name's Chris Schilling. I'm a health economist at KPMG. And where I come in is really making the economic argument. So Andrew's spoken about an equity argument for more investment in mental health. That argument's around the fact that Victoria's really had a sustained level of underinvestment in mental health services, and as a result really lags behind other states and territories. Andrew also touched on the human argument, the fact that these are real problems faced by real people, and what I've been adding is the economic argument. And so what you see in mental health is that there's a really strong return on investment for interventions in mental health.
Can you quantify that a little bit?
Yeah, absolutely. And so what Mental Health Victoria have shown here is that they're looking at an investment of a bit over $500 million. And over the long term, that's actually going to generate benefits of over $1 billion. But why is that? It's actually pretty simple. There's huge returns on investment in the workplace. Yep. So people that are mentally healthier are much more productive and much more likely to be at work. They're also less likely to be in hospital. Hospitalisation, particularly acute and lengthy hospitalisations, are costly. And there's also other dealings around homelessness and interactions with our criminal and welfare system.
You gave one really interesting statistic about employment, that the average adult employment is 61%, and where does it slide?
Yeah, so if a person was homeless during their adolescence, it can drop down to 24%. If they're homeless between the ages of 15 and 24. If they're homeless before the age of 16, that drops to just 10%. So just 1 in 10 teenage people who are homeless actually go on to end up in employment. It's a damning statistic.
It's pretty compelling, that's right. Thank you very much. And Liz, can I just come back to you on that and say, do those points resonate for you at the front line?
Absolutely. When a person is becoming unwell, they know that things are not working for them and they seek assistance. They're told, go away, and things get worse and worse and worse, and people lose their skills during that period and their belief in the future.
Thank you very much to all of you.